In our morning rounds, we are looking at how the pandemic is affecting breast cancer detection. Today is the first day of Breast Cancer Awareness Month. One study shows that breast and cervical cancer screenings dropped 94% in March in this country. In June, breast cancer screenings were still 29% below pre-COVID levels. Our senior medical correspondent, that's Dr. Tara Narula, we love her, introduces us to a woman who knows firsthand that early detection saves lives.
What were your initial thoughts when you were told that you had breast cancer?
Well, I just said, here we go, it's my turn now.
63-year-old Norma Atwood has been giving mammograms for over 2 decades. She delayed her own routine screening in March because of the pandemic. And when she finally had her mammogram in May, she got the news she never wants her patients to hear.
Were you surprised to learn that something had developed there in the year since you'd had your prior mammogram?
Yes, but I've seen it happen many times.
And once you were diagnosed, you underwent a lumpectomy?
Yes, it was a grade 0.
Are you cancer-free today?
Yes.
Somebody says to you, I'm concerned about coming in because of COVID. I'm concerned about having a mammogram done. What is your advice?
We're safe. We take all precautions. I will even clean it in front of the patient for them to be reassured.
She works at Sutter's Alta-Bates Summit Medical Center in Oakland, California, where 4,000 to 5,000 patients have postponed mammograms because of COVID-19. Sutter Health estimates that 20 to 25 of those patients could have cancer that's undiagnosed. Atwood's grateful she's not one of them. And she's determined to help increase screenings using a mobile mammography van that will soon visit underserved communities throughout the East Bay area.
Does this make you more able to tell other women that it's so critically important that they get their mammogram?
I have always told my patients the importance because I've seen it happen so many times. So this was no different. Do not wait over a year. Come in every year.
Dr. Tara Narula joins us now. Tara, the numbers are really kind of scary. 285,000 breast cancer exams were missed during the peak months of COVID. Why is it so important that we go? But we are afraid to go to the doctor's office.
Yeah, well, those numbers are really alarming, Gail, because what we know is that screening really can affect our ability to pick up cancers early at a stage when we're able to treat them, and it can save lives. And there are estimates that all of these women that have missed their screenings may translate in the years to come to increased deaths. And I think what the important message is that we're not talking about missing your mammogram for someone who is average risk without symptoms for 1 or 2 months. That's probably fine. What we're talking about is really missing it for 6 months, a year, or 2 years. And that we worry many women may do at this point. So important to note the statistics: 1 in 8 women will be affected by breast cancer, second most common cancer after skin cancer, second leading cause of cancer death in women after lung cancer, and it's estimated about 40,000 women will die this year from breast cancer. Wow. So very, very important to get screened.
Early detection is so important. So how do you reassure women? I've gotten a couple of notices from doctors, including your office, Tara Narula. Gail, come in and get your heart checked, where they say, listen, you need to come in and get this done. How do you reassure nervous patients that it's okay to come into the doctor's office?
Right. Well, you just said it. I mean, one thing is having that conversation with patients and letting them understand that there are certain things that need to be a priority. And I think it needs to be a conversation about what is the risk versus benefit of coming in. And that really depends on your personal history, your family history, your risk factors, and what was the interval between now and when your last screening was. Also, we try to really reassure people that we've taken in a lot of offices and clinics around the country very massive steps towards making sure that it is safe, that we screen patients ahead of time for COVID, that patients are spaced out, that there's social distancing, that there's masking. So it is safe to come into the office if you need to. And now may be a really good time before we see a potential second surge, before we get to the peak of flu season and systems become overwhelmed. So pick up the phone, have that conversation with your provider, and see if you should come in.
That's a really good point. And what age should women start getting mammograms? I hear 2 different numbers.
Yeah, there is a little bit of confusion out there because there are different guidelines and different organizations saying different things. But in general, most of the groups recommend that women start being screened at age 40. The American Cancer Society says that you can have a discussion with your provider about starting at 40, and if that's something a woman wants, she can certainly do that. They recommend starting at age 45 with those annual mammograms until 55, at which point a woman can then decide every year or every other year.
Yeah, I don't see a downside in getting a mammogram ever, regardless of the age.
Yeah, well, it is a discussion. Certainly, you know, the risks that are talked about are really finding what we call sort of false positives that can lead to overdiagnosis and overtreatment. But certainly, as I said, the bulk of the major societies and groups really do feel that 40 is a good starting point.
All right, Tara Narula, always good to see you. Can't wait till you can come back to the table in person.
Me too.
Good to see you, though.
Thank you.